Well, good afternoon, everyone. Welcome to Health Check, where you can stop, take a minute, check in on you. I'm your host, Dr. Vanessa Bolling. As you know, Health Check is sponsored by Kingdom Health Connections, where we are here to help you connect to a healthier life. How about connecting to a healthier life by being self aware? I know I've been away for some time, but rest is so important. Do you know that rest is a part of making sure that your physical body is in good health? Yes, REST. No, I didn't. Well, yes, RESPECT is a matter. The way in which we respect ourselves is by resting as well. When I spelled out REST, it made me think of RESPECT. So we respect ourselves by resting as well. But I'm so delighted to be here today with you this afternoon, maybe on your lunch break, maybe on your walk break. I'm just here to share a few health tips for you this week, a few health vitamins. As you can see in the description, this is all for educational purposes, not for medical advice. You always want to be in contact with your PCP as well as your specialist. Well, today's topic, as you know, the month of February is dedicated toward heart health awareness. So I'm going to encourage you in your heart health today by talking about blood pressure monitoring at home. This is something that I often see in the offices. And this is often a discussion that I have in the offices as well. When individuals come in, clients come in with their blood pressure readings. And it's always a matter, are we taking the blood pressure accurately at home? So I want to leave with you 10 tips as to how to make sure that you are taking an accurate blood pressure at home. So the first tip is you want to make sure there's no stressors 30 minutes prior to taking your blood pressure. What are those stressors? I'm glad you asked. That includes physical activity, exercise. That includes caffeine. That includes smoking. That includes energy drinks, things that will stimulate the heart to be more responsive. No stressors 30 minutes prior to checking your blood pressure. Tip number 2, use the bathroom prior to checking your blood pressure. That also can act as a stimulant. If you have to use the restroom, if you have a full bowel or a full bladder, that will stimulate your blood pressure to be a lot higher. So use the bathroom prior to getting your blood pressure checked. You want to make sure that you rest for 5 minutes, 5 minutes prior to checking your blood pressure. You want to be in a seated position for 5 minutes prior to checking your blood pressure. You also want to make sure you have the right positioning. Let me share with you here this picture that you might find to be a bit helpful. So you see this individual's here, their palm is facing up to the ceiling. Their arm is rested on a table, relatively at the level of the heart, and they're in a rested position, probably in a chair or a stool of some sort. So right positioning is about making sure your palm is facing the ceiling, your arm is rested on a table that's at the level of the heart or relatively close to that, to make sure that you are in the right positioning. I want to give credit also to where these images come from. So right positioning. When you're at home, unless you have someone who's been trained in taking manual blood pressures, you want to have an automatic biceps cuff, as the ones listed in the picture here. This is an automatic biceps cuff. You know it's automatic because the machine is the one telling you what the blood pressure is, rather than someone reciting it to you. So having an automatic biceps cuff is preferred. That it's more preferred than having a wrist blood pressure cuff. It's more accurate when it's closer to the heart. More accurate when it's closer to the heart. So having an automatic biceps cuff is preferred. I hope you're finding these tips are helpful thus far. All right, let's move on to the next tip. Tip number 6, monitor your blood pressure the same time daily. So if you're typically going to monitor your blood pressure in the morning, 10 o'clock, do it around that time. You have a window of time. You don't have to be perfect with it, but try and monitor your blood pressure the same time of the day. Your blood pressure fluctuates throughout the day, so what's in the morning is different from the evening. So try and get it the same time every day. Tip number 7, measure it directly on the skin. Do not take your blood pressure over your clothes. It's preferred to do it directly on the skin. That's the most accurate reading possible. Believe it or not, the clothes, though they may be thin, they do take up space. So that can alter the accuracy of your blood pressure. Tip number 8, make sure we have the correct blood pressure size. All right, I have a little example here. This is a manual blood pressure because I take them manually. And you'll see whether you get an automatic cuff or if you have a manual blood pressure cuff, you'll see here these 2 arrows. And it says minimum and it says max, right? So that means when I close this cuff should be at the minimum here or the maximum here. So when I close it and it's around your arm, I should have this room remaining right here. See where my fingers are feathering? That should be let's do it this way. We should have a little lag time here, right? So that's how you know that you have an appropriate blood pressure cuff size. If it's way too small, that cuff is covering the entire bicep and there's no lag time here. You want some lag time. That's how you know that you have the appropriate blood pressure cuff. Tip number 9, you want to bring your blood pressure machine with you. The automatic biceps cuff, you want to bring it with you to your next appointment. Why is this important? Because if it's truly an accurate blood pressure machine, it will be consistent with the machines in your office or the manual blood pressure cuff in your office. So it should be pretty consistent, give or take 10 points. It may be off, whether it's the left arm or the right arm. It may be off a little bit, but it should be relatively consistent. When it's not, then perhaps that blood pressure cuff is not as accurate. And you always want to make sure that you bring it with you to your next blood pressure monitoring appointment. And tip number 9, keep a journal and keep a log of your readings. This is so important because it helps you to be aware as well as helps your healthcare provider to be aware of what's the trend of your blood pressure. Is it much higher here in the office? We call it white coat syndrome, white coat hypertension, or is it lower at home? It helps us watch the trends. Is it consistent with this blood pressure machine that you have? Again, that gives us clues as to whether this machine is accurate or inaccurate, as to whether also if your blood pressure is much lower at home, you're less stressed at home versus when you come into the office. So I hope that you really found these 10 points to be helpful. These 10 points were also inspired by the American Heart Association. I want to give credit where credit is due. And these are the 10 points that we use in our office settings as well. So go ahead and put hashtag I choose life. Today, we have the choice today between life and death, blessings and curses. I call on all of heaven to witness the decision that you and I make. Oh, that we would choose life so that not only we would live, but our descendants would live as well. Go ahead and put hashtag I choose life. Say how you're going to choose life. And I encourage you to choose life by checking your blood pressure. Once a month at the Apostles' House, if you're in the Hartford region, at the Apostles' House every third Sunday, we host a blood pressure clinic. We will be there to meet with you, to check your blood pressure, to check your heart rate. Become aware this year. Make your health a priority this year by becoming aware of what your blood pressure is. Hypertension is known as the #1 silent killer. You can have really high blood pressure with no symptoms. And that's very dangerous because there's a lot of work that's happening in the heart that you're not aware of. And then different complications can result from them. So become aware this month. Challenge yourself. Beat the fear. Put fear to the side. Bind the fear, right? You don't need to operate in fear this month. Heart Health Awareness Month. Be aware of what your blood pressure is. Be aware of what your heart rate is. And let's make the steps to make sure that our heart remains in good health and prospers so that the rest of our physical body can also prosper. I'm your host, Dr. Vanessa Bolling. I pray that you are all blessed today. I will see you here again next week, Tuesday. I have a special guest with me. Throughout the rest of the month, I'll be talking about mental health and how it relates to our heart health, as well as nutritional health and how it relates to our heart health. So tune in with us every Tuesday in the noontime, lunchtime hour. We're here to meet with you, encourage you in your health journey. We'll see you then here next week, Tuesday. Bye-bye. Have a blessed, prosperous, heart healthy day. In Jesus' name. Bye-bye.